This is KTVO's Good Morning Heartland.
And welcome back. May is National Arthritis Awareness Month, and to learn more about it and the signs and symptoms you should look out for, we invited Dr. Kevin Marberry, ATSU KCOM Associate Professor and Chair, this morning to break it all down for us. How are you doing?
I'm doing very well, thank you.
Thanks for coming on.
Thanks for having me.
When we think of arthritis, I personally, and I don't mean to, but I think of older people. And so kind of break down what arthritis is and actually who it affects.
Yeah, that's a good question. Actually, arthritis is a group of conditions that affect the joints of the body that lead to destruction of the joint, and then ultimately to pain and stiffness and discomfort within the body. It can lead to limitation of range of motion, debilitation, a feeling that the patients just don't want to get up in the morning and just get out and about.
All right, so let's talk about some of the statistics that we have, and we're going to pop those up on the screen. So talk about these numbers.
Yeah, as you know, it's a very, very common condition. Arthritis affects about 46 million adults in the United States. And actually that number is projected to increase to about 67 million in 2030. It's extremely common. We see it a lot in clinic, and we perform about 600,000 total joint replacements every year in the United States. And this leads to a very large healthcare cost. It's a very large burden to our system. It costs about $22 billion per year to treat arthritis in the United States. The nice thing about arthritis, though, is that it's preventable. One of the things that is preventable is a major joint injury, and that we know that about 50% of people who have a major joint injury will develop arthritis within about 10 years.
Wow. So let's talk about the different types of arthritis. There's obviously more than one, so kind of touch base on all of those.
Well, there are several types of arthritis, obviously. And one of those is osteoarthritis, and that's the one that you most commonly learn about or hear about, and that has to do with normal wear and tear within the joint. There's a condition called post-traumatic arthritis, and that has to do with debilitation of the joint or wearing out of the joint after an injury of some sort. Rheumatoid arthritis, that's another one, and that's the body's self-destruction of the joint. And there are other types of arthritis that have to do with autoimmune conditions that we probably won't have time to discuss today.
Right.
But of all of those, the one that's most common is osteoarthritis.
Now, when you say that's most common, and when you said it's the wear and tear of joints, now do a certain type of group of people get this arthritis because, you know, they're athletes or they're a lot more active, like runners out there that run, you know, marathons and stuff like that? Are they more prone to develop arthritis?
You know, that's a very, very good question, and it's a complex question. It really can't be answered. We do know that after a joint injury, your risk of arthritis skyrockets.
Interesting.
So it is something that people with a joint injury at a young age need to be aware of, that at some point in time throughout their lives they may actually develop arthritis because of that injury that they had many years ago. But really the face of arthritis is not one single type of arthritis. There are all sorts of different types, as we've discussed, all sorts of different types of people that are affected by arthritis. So there really isn't one single stereotype of arthritis, really.
Well, that's good to know. So I know that we touched base a little bit earlier about the symptoms. Go ahead and kind of just refresh our memory of if I'm, you know, my joints are hurting or something like. What are some other symptoms I can look out for if I do have arthritis?
Well, and that's what I tell patients when they come to see me, or when I talk to patients. I just say nobody should live with joint pain. So whether it's shoulder pain, wrist pain, hand and finger pain, hip, knee, ankle, whatever the joint may be that's affecting them, I say, you know, people shouldn't live with pain. So sometimes pain within the joint is arthritis, and that's something that can be evaluated by us as physicians through x-rays and physical examinations and evaluation of the history. But as far as the symptoms of arthritis are concerned, typically stiffness of the joints, pain within the joints. The stiffness usually happens in the morning when they wake up, and patients just don't feel like getting out of bed in the morning.
What about popping?
Popping, cracking, that type of thing. Mechanical symptoms is what that's called. So those are also associated with wearing out of the cartilage that covers the ends of the bones, and that's essentially what arthritis is. is wearing out of the joint.
So what about for those people, including myself, and my mom always yells at me because I pop my knuckles. Now, can I get arthritis from popping my knuckles?
I hear that question all the time, and I don't believe there's any evidence to support that claim.
All right. And let's talk about treatments really quickly.
Yeah.
What are some treatments out there?
Well, there are all sorts of treatments. There's anything from simple awareness of the condition. Just learning about arthritis is actually been shown clinically and through scientific experiments to reduce the physical burden of arthritis. So just learning about the condition is effective. Losing a little bit of weight may be effective. Losing 5% of the total body weight has been shown to help the symptoms of arthritis. Being active and exercising. The CDC, the Center for Disease Control, recommends about half an hour of exercise per day, and that's effective in reducing the pain associated with arthritis. Outside of these sort of conservative, non-invasive, non-operative types of condition treatments, we can move into medications, so anti-inflammatory pills, medications that can take care of the pain associated with arthritis. Injections into the joints. Sometimes we'll do cortisone shots or steroid shots. We also have lubricating shots that we can inject into the joints to help lubricate the joint a little bit better. And then, of course, as we talked about earlier, moving on to operative types of treatments, we can do minimally invasive things like doing a scope, just making a small incision and cleaning out the joint on the inside. Or even if it's beyond repair, we can move to doing a total joint replacement where we replace the entire joint with metal and plastic.
Wow.
Yeah.
So very complex things. A little bit, right?
Yeah, very complex.
So what we'll do is we'll post all of this on our website at heartlandconnection.com, as well as Dr. Kevin Marberry's information. Thank you so much for coming on. I appreciate it.
You're welcome. Thanks for having me.
And we'll be right back.